Insect vectors of human diseases and their biology. Chikungunya and Zika virus disease. Chikungunya fever is an arthropod-borne viral disease transmitted by Aedes aegypti and Aedes albopictus mosquitoes. It is characterized by fever, headache, rashes, and deliberating arthralgia. Chikungunya means to walk, to bend over in the Makonde language. I'm not sure about the pronunciation of this. So this is the classic posture adopted by the patients during the acute phase. It is caused by chikungunya virus, an alpha virus belonging to the Togaviridae family. It is transmitted to humans by mosquito bites and also affected to non-primates. Aedes mosquitoes, particularly the Aedes aegypti and Aedes albopictus species, are responsible for transmitting chikungunya virus. Aedes aegypti, commonly known as the yellow fever mosquito, is the primary vector, while Aedes albopictus, the Asian tiger mosquito, was the secondary vector. The mosquitoes are distinctive with black and white striped patterns on their bodies, making easily identifiable. They breeding standing water such as stagnant pools, containers, and discarded tires, creating ideal environment for their larvae. They are adaptive in nature and enable them to breed both urban and rural settings, increasing the risk of chikungunya transmission. The species exhibited a daytime biting behavior, making personal protective measures crucial in controlling the spread of chikungunya. Life cycle of this virus. Life cycle of this virus can be divided into 3 stages as follows. Life cycle of chikungunya virus can be divided into 3 stages as follows. Initial stage virus infection, chikungunya virus and their human body via the salivary glands of the mosquito. When an infected female Aedes mosquito bite, it introduced the virus into the bloodstream of the host. Soon after entering the bloodstream, the virus gets attached with the permissive cells, especially one of the nose, throat, and mouth. Cellular and infection stage. In cellular stage, the chikungunya virus make its way to the cytoplasm and finally to the nucleus. After entering the nucleus, the virus releases its genetic material and replicate the genome. After passing the cellular stage, virus enter into the surrounding tissue and being infested to the other cells as well. It proliferate in the bloodstream and enter the body, causing main infection. It's only after 2 to 12 days of an infected mosquito bite that the symptoms of illness occur, characterized by sudden onset of fever, severe pain in the joints, and skin rashes. Mosquito bite. When a mosquito bites the above stated viremic in most of the human who has been infected, the virus is transmitted to it and it gets replicated in the midgut, ovary, neural tissue, and fat bodies of the insect. The virus reproduces there and migrates to the salivary glands of mosquitoes. As the infected mosquitoes bite someone, the life cycle of chikungunya virus transfer it to the another person, making another viremic host. In symptoms of chikungunya, symptoms: rash, back pain, joint pain, vomiting, nausea, headache, chills, and fever. Joint pain, vomiting, nausea, headache, chills, and fever. Severity of illness varies from person to person, but for many, the joint pain is very severe. The great majority of people who have the virus develop symptoms, although in 10% to 15% of infections, there are no signs of illness. So symptoms generally last for several days to several weeks, after which most people recover fully. However, symptoms may relapse months or years after recovery. In some people, joint pain may become chronic, lingering for months or even several years. Other possible long-term or severe complications include prolonged months to years muscle pain and fatigue, then inflammation of the eyes, And brain inflammation and other neurological effects, depression, liver, kidney, and heart complications, stomach and intestinal complications, compliance. Yeah. So, how to diagnose this? RT-PCR, chikungunya virus may be detected directly in the blood samples collected during the first week of illness using tests such reverse transcriptase polymerase chain reaction, then ELISA enzyme linked immunosorbent assay may confirm the presence of IgM and IgG anti-chikungunya antibodies. Antibody levels are typically detectable by the first week after illness onset and still can be detected for about 2 months. The clinical management include addressing fever and joint pain with antipyretics and optimal analgesic, drinking plenty of water and general rest. There is no specific antiviral treatment therapy for chikungunya virus and no commercial vaccine available against chikungunya virus. Controlling mosquito populations by limiting their habitat, insecticide or biological controlling agents can be used. Use of insect repellents such as DEET, PMD, wearing bite-proof long sleeves and trousers and securing screens or windows and door at the house. And Zika virus disease. Zika viral disease is an arthropod-borne viral disease. Zika virus belongs to the family Flaviviridae and genus Flavivirus. It was first isolated from the rhesus monkey in 1947 and first human infection was described in Nigeria in 1952. It is usually transmitted by the bite of infected mosquitoes. Thus, mosquitoes are the important vector. The clinical presentation of Zika virus is non-specific and can be misdiagnosed and as other infectious disease, especially those due to arbovirus such as dengue and chikungunya. Zika virus is in 500 nm enveloped RNA virus with an inner nuclear capsid and an outer lipid bilayer. The Asian lineage has been responsible for the current global expansion of Zika viral infection. Zika virus is considered as an emerging infectious disease with the potential to spread to new areas where the Aedes mosquito vectors present. Aedes aegypti and Aedes albopictus have been involved in large breakouts of Zika virus. Also, other species of this genus are Aedes hensili, Aedes polyneesians, Aedes furcifer, Aedes Taylor and Aedes leucocephalus. Aedes is closely associated with human environment and can breed indoor and artificial outer environment, which is served to establish the vector breeds in a clean water and with low organic content and dissolved salt by lysis eggs on the surface of the container at the height of the water. What? Aedes aegypti does not stay far from their breeding sites. Observations indicate that can get away 200 to 300 meter and up to a kilometer or more. Another important aspect in relation to the adult mosquito is fact that activity is limited below 40 degrees Celsius and oviposition is affected below 70 degrees Celsius. Aedes albopictus can thrive a wide range of water-filled breeding sites than Aedes aegypti, including coconut husk, cocopods, bamboo stems, tree holes, and rock pools, in addition to artificial containers such as vehicle tires and plant pots. It is a wild species that has adapted to urban environments. Female distribute oviposition in separate containers, a habitat that contribute to the faster dispersion of the species. Optimum temperature for development is 25 degrees Celsius. Life cycle. Transmission from mosquito to human. Life cycle begins a female in Aedes mosquito, usually Aedes aegypti or Aedes albopictus, acquire the virus by feeding on infected human. So the virus enters the mosquito's midgut and then infect various tissues within the various tissues with the mosquito. Virus replication in mosquito. Zika virus undergoes replication in the mosquito's midgut cell. Over the time, the virus spread to other tissues, including salivary glands, making the mosquito capable of transmitting the virus. And mosquito transmission to human after an incubation period within the mosquito virus spreads in the mosquito saliva. The infected mosquito then bite the human, injecting the virus into the bloodstream and initiate in the human phase of the life cycle. Virus replication in human. Once in the human host, virus target various tissues, including skin cells, fibroblast, and immune cells. The virus replicates, leading to viremia and can cause symptoms like fever, rash, joint pain, and conjunctivitis. Then transmission from human to mosquitoes. Mosquitoes can acquire the virus by feeding an infected human during the viremic stage. The infected mosquito become potential source of transmitting the virus to other human during subsequent blood meals. Through mosquito bites from mother to child, through sex, through blood transfusions, through laboratory and healthcare setting exposure. Symptoms: joint pain, fever, headache, conjunctivitis, skin rash or exanthema. Exanthema. Conjunctivitis. Virus infection during pregnancy is a cause of microcephaly and other congenital malformations in the infants, including limb contraction, high muscle tone, eye abnormalities, and hearing loss. These chemical features are collectively referred to as congenital Zika syndrome. So, Zika infection in pregnancy can also have complications such as fetal loss, stillbirth, and preterm birth. Zika virus infection can also cause Guillain-Barré syndrome, the neuropathy and myelitis, particularly in adults and older children. People with symptoms such as fever or joint pain should get plenty of rest, drink fluids, and treat symptoms with the antipyretics and analgesics. Pregnant women living in areas with Zika transmission or developed symptoms of viral infection should be seeking medical attention for laboratory testing, information, counseling, and other clinical care. No vaccination is available for the treatment of the Zika virus infection. Prevention of mosquito bites during day and early evening. Personal protection measures include wearing clothing that cover as much as the body as possible, using physical barriers such as window screens and closed doors and window, and applying insect repellents to skin.